hold on. As you know, Rise Above the Abuse goal is to empower women. And October is Breast Cancer Awareness Month. So I wanted to bring on a couple experts to help you understand what breast cancer is. And also, my next guest that's coming up in a couple weeks will also tell you about living with breast cancer. But today, we have nurse practitioner Robin Wells. Hi, Robin. Thank you for coming and being with
Hello.
us today.
Yeah.
So,
Yes. Thanks for
Robin,
having me.
you're very welcome, Robin. So Robin's been a nurse practitioner at Springfield Clinic for over 17 years. She works in the obstetric and gynecology department. She believes that healthcare should be rooted in both evidence, but also in heart. Her patients know her as someone who will listen to them, advocate for them, and help them any way that she can. And on a side note, she makes you feel safe
Mm.
and letting your guard down because I personally have cried more than once in her office because
We
Robin,
cry together sometimes.
I know,
I cry with you.
yep, because I've known Robin for the 17 years she's been at Springfield Clinic.
Yeah. Yeah.
So she really does create a safe space where women feel like they're seen and they're heard. She always brings a positive energy wherever she goes, always has a smile on her face. She believes that work should be enjoyable, which is why having fun with her coworkers is so important to her. Like I said,
Hmm.
she finds it important to create a warm environment for her patients where they can really be
Hmm.
seen and heard as a person and not just
Hmm.
a patient or an MRN number.
That's right.
She has a who's who list, and I didn't know this until I got this, of
Yeah.
accomplishments, of volunteering, of being on committees and boards. So I'm going to read you some of them.
Yeah.
So she has completed her BSN in 2000, went back to school to get her MSN. That was in 2008. She is also certified American Nurse Credential Center, an FNP. She is on the committee at Springfield Clinic for Springfield Clinic Quality Improvement and is currently on the Advanced Practitioner Committee. She is a board member for Nurse Honor Guard. She is also a nurse practitioner and women's health member, 2025 Menopause Society member, which, side note on that also, we're going to have to do a video on that because
Oh,
that's
yeah.
huge.
Totally. Yep.
And so many people don't know because, you know, when
Oh,
we were
yes.
growing up, you didn't talk about that stuff.
No,
We're going
no.
to
It's
have to do
definitely
one.
out there now.
Oh,
Yeah.
gosh,
Especially
yeah.
with social media is getting it out and just women advocating for themselves, being stronger, which is kind of your platform, and
Right.
speaking up and saying, hey, we need this, we want this. Women are not little men. We need to be treated differently in medicine.
Absolutely. Yeah. Because, you know, when you go through it, you think you're going nuts with all the craziness that goes on with it.
Yes. Yes.
She
I'm
also,
going through it right now. So I'm
I
riding
know.
the roller coaster. I'm in the front seat. So I
Yep.
got it. You
Me
too.
too.
Yep.
Me too. She
That's
has
right.
previously served on the St. Jude's Children's Hospital Fundraiser Committee. She has also participated in the Susan G. Komen Breast Cancer Walk and the Kids Fun Run, um, which are both here in our Springfield area.
Yeah, and this Sunday at Southwind Park is the Life Strides or Strides for Life Breast Cancer Walk. You can look it up.
So, Robin believes at the end of the day, her goal is to help make a difference in the lives of her patients, support and uplift them and her work family, and keep growing as a nurse practitioner. Did you want to add anything to that, Robin, that I forgot or didn't
No,
know?
no, that sounds good to me. That's enough accolades for one day. Yeah. No.
Okay. All right. Great. Yeah, I
Nursing
didn't
for
know all that.
20, yeah. Been in the nursing field for over 25 years. So that stuff sneaks up on you, all those things kind of add
It
up over
does.
the years.
Yeah, it
Yeah.
does. Well, congratulations. That's all very important in women's health.
Yeah. Yeah. Thanks. Yeah.
Okay, so I'm going to let you talk a little bit about, breast cancer awareness and, um, detection. How do you detect
Mhm.
breast cancer?
Yeah. Yeah. So, like over the years, I think breast cancer awareness has evolved significantly with it being on definitely television before, like, social media came out. And now, over the last like decade or so with social media, it's really out there. And awareness, I think, is the key um, to that. And knowing what your breast should look like normally or what is abnormal. I think that's a huge important part to realize what is normal kind of for your breast. And if you feel something you're concerned about, to definitely go in and notify a healthcare provider or somebody in the community, if it's at the health department who can facilitate and do a clinical breast exam. But some kind of like top key things that I go over with my patients are um, any like redness or swelling, which could be from even just like a little skin infection or something. But if it's not clearing up in a couple days, if it's getting worse, if definitely lumps are confusing because our breasts don't just feel like a soft pillow. Breasts do have normal, fat lobules, maybe even a cyst. But what I tell patients is typically something that's smooth, round, bouncy. If your breasts kind of feel like a little sack of cottage cheese or Rice Krispies, and that's kind of normal for you, then that's kind of your baseline. But if you feel something that when you're like putting your bra on and you're like, oh, that feels weird, and it's something that doesn't go away in a couple days or is getting larger, or you just have kind of that intuition that something's wrong there, then I say come on in and we'll double check it. Swollen lymph nodes in the axilla. I don't get a lot of that. A swollen lymph node's kind of like a marble that you'd kind of feel, or like a jelly bean in the axilla. I always describe it to my patients like, when you get a sore throat and these lymph nodes are swollen and they feel like marbles. Those
Yeah.
are the same difference underneath the armpit. I've never had a patient with breast cancer have anything like that, but you know your body the best when you're washing in the shower to be kind of mindful of something like that. And those lymph nodes can um, enlarge when you are sick or when you have allergies or when you've shaved and maybe got a little bacterial infection in there sometimes. Definitely watch the nipples. We always say that nipple inversion can be a risk factor of a possible lump underneath the breast. Now, some people are born with inverted nipples. If you've always had an inverted nipple, you weren't born with breast cancer. It's a change where your nipple kind of was normal or everted, and then like all of a sudden one day it's pulled in. So that potentially could be a sign. It's not like telltale, like, oh my God, you have breast cancer now. So none of these things are absolute. I never want to fearmonger anybody, but definitely just things to kind of be aware of. And I know a big slogan out there is detection is the key to, like, early detection is the key to survival. So definitely going and starting your mammograms, which the recommended start for an average woman is 40 years old. So at 40 is when my patients come in. I start giving them an order for a yearly mammogram screening. There is what is it? It's like Breast Cancer Awareness Mondays at Memorial Medical Center. I know they have free mammogram screening on Monday. You do need to call the Memorial number, the 788-3000, or there's probably a link on there for the actual mammogram scheduling center. But if you called the 788-3000, they could probably direct you to that because you do have to be scheduled. You can't, it's not just a walk-in. It is free, but it's not a walk-in. And then I think you had something on there about the Illinois Breast and Cervical Cancer Program. That is a thing. I do use that too for my
Okay.
patients that don't have insurance or their insurance don't cover mammograms. I will call, and there is a number. If you Google that, there's a patient line that you can call to. But I have a representative that I talk to, and she will contact the patient. And I've gotten free mammograms for patients before that do not have coverage. So, I mean, I'm kind of sidetracking over here, but it's all
No,
kind of
you're
tying
fine.
together.
No, you're fine. Yeah,
Um,
I didn't know if that was even a thing anymore. I know
it is,
back when I
yeah,
worked in women's health that that was a thing. I
right.
just didn't know if it was still
Yeah,
there or not.
it's still. Still going, Gina. Still
Well,
going.
good.
It's crazy. But yeah, I remember when I started like 17 years ago, it was a thing, and then it's still there. Like I said, I talk to a representative from there a couple times a year. So yeah.
That's good.
But
I'm glad that that's still there for people.
yeah, I'm trying to think anything. Yeah, so and then definitely look into family history, make sure, talk to your see if you can get
Mhm.
any information or feedback from your mom, your grandma, because it can be genetic. I think you had asked me about some genetic issues with it. Some
Mhm.
women are just average risk because they've never had breast cancer, their mom hasn't, sister hasn't, aunt, grandma. That's my family. I did have a first cousin, but her breast cancer was inherited from her other side of the family that's not related to me. So I don't really have any breast cancer family, but there are people that do, and we do special screenings, like computer entry screenings on those patients. If you come in and have a family history, I'll enter like your age and when your first period was, and if you're menopausal, and your weight, and if you've had children. And I enter this into a system called the Tyrer-Cuzick score. And if your risk is over 20%, you're at high risk. So we do more screenings on you. Or, like I said, depending on family history, we might talk to you about seeing a genetic counselor for some blood work to see if you have any genetic mutation, and that's where the BRCA1 and the BRCA2 mutations come in.
Yeah.
Um, BRCA1 is a gene that we have, and if that gene is mutated, the BRCA1 gene like cleans up like crappy cells or abnormal cells. If that
Okay.
gene is mutated, it can't clean up those crappy cells, and then that increases your risk of breast cancer. So, it's definitely something important to look into your family history.
And because my medical history. But in my family, my mom had breast cancer, my aunt had breast cancer. I had a cousin who was in her 30s with breast cancer, and then within the last 2 years, a niece, my brother's daughter, was diagnosed with breast cancer.
Yeah.
So when you have that, it's important
Yeah.
that you get the screenings, and generally when you have that kind of history, you start your mammograms earlier because of that
Mm-hmm.
risk factor. Um,
Mm-hmm.
so to know, like I said, to know your family history is very important. If you can
Yes.
get that
So
information,
yeah,
give it
right.
to your doctor.
Yeah. And just comparing the two of us, you're screening, you're more at high risk, where I might talk to you about, we'll do that Tyrer-Cuzick score. We'll refer you to the genetic counselor. We'll start screening you earlier. Whereas me, I'm average, 40 years old. I don't really need the Tyrer-Cuzick score or nothing like that. So it is different patient to patient. So it is
Right.
very important to kind of know your family history and reach out to a healthcare provider about if you need to start screenings earlier, if you need any genetic testing. And with that too, I don't want to forget adding in there, because I think it's important to me, and this is something I go over with my patients too. Sometimes you can supersede nurture over nature with any genetics. There are, survival of the fittest. And when I'm talking about that, what I talk about is the foundation of all healthcare. And that's very important to me as I've gotten older, because it's important as an older person, but it's definitely important the whole lifespan. Is start with like trying to do the clean eating as much as you can. Start with drinking your water and watching your high fructose corn syrup type of drinks and crappy food that you're putting in your body, and try to do more exercise. Um, Try to get rest, try to decrease your stress, because all those things have shown to decrease your risk of breast cancer and survival of breast cancer. If you're clean eating, if your exercise is a huge motivator to decrease your risk of cancer and increase survival rate if you do have it. Another thing that decreases your risk of breast cancer and a lot of cancers in general is a healthy weight. We say if you
Yeah.
like a key thing that I tell patients is um, losing 10% of your body weight prior to menopause or right after menopause, because we tend to, as perimenopausal, menopausal women, our metabolism slows and we tend to gain weight. Research has shown if you lose 10 pounds prior to menopause or 10 pounds right after menopause, that can even decrease the risk of breast cancer because it's that subcutaneous fat, like over amount of that increases risk of cancers.
Right.
Pregnancies can decrease your risk. So if you've been pregnant or had several pregnancies, that can decrease your risk. Breastfeeding decreases your risk. Not smoking, a huge one, decreases your risk. And minimal to no, preferably no alcohol, huge, decreases your risk.
Yeah.
Something I don't want to forget to say too is the big thing that's out there about breast density. It's a whole nother can of worms, but breast density just means you have more breast tissue than fat in your breast back. And then about 10% of women have extremely dense breast tissue, which means their whole breast is full of tissue and minimal fat. Well, that kind of puts you at a little increased risk of breast cancer because you have more tissue, and breast
Right.
tissue is going to be more prone to a breast cancer. So we do offer more screenings for the women with the heterogeneously dense and the extremely dense breast tissue. It's not a guideline right now to have more screening, but I do talk to my patients about it and I offer if they want more screening because with the dense breast tissue, it does decrease the sensitivity of the mammogram a little bit. If you think about the radiologist looking at the image, when they look at the image of the breast, now I'm not trained to look at it, nor are any like OB gynecologists typically trained. It's the radiologists and the ones that we have at Springfield Clinic. I know several of them have like a special certification in mammography. I don't, and when they're looking at the images on the computer screen, breast tissue is like cloudy. It's like white clouds, and they're looking through the white clouds to see like a bright white lesion indicating to them that hey, this needs looked at either by a diagnostic mammogram, ultrasound, breast MRI, and then they go to a biopsy after that. But so that's kind of some education. There's no guidelines now for heterogeneously dense or extremely dense breast tissue to have extra screening. Like I said, I just talked to my patients about it. We decide, do you have a family history? Are you at high risk? Is it something you want? Some people want the extra screening and other people do not, they choose not to have it. I don't think there's necessarily a right or wrong answer. I think it can be individually based.
Okay. And now what if somebody has implants? What does that change anything? Like you said you should know your breast, and does that
Mhm.
change their density, the feel of their breast?
It does. It does change the feel of their breast. Typically, I've only had, I think, one or two patients with breast cancer with implants. Younger. I think they were both in their 40s, younger women, and they were able to find the breast cancer themselves. They did a self exam, found felt like a little rock in their breast, and that's another thing. Going back to what you're going to feel, I said what the normal kind of lumps and bumps feel like. The abnormal feel more hard, more kind of like a gravelly rock that's in there, irregular bordered, fixed or rooted, not moving and possibly changing. So it is something that you can feel breast cancer, and it can be seen on your mammograms with your breast implants.
Okay, that's good. That's good. Do you still recommend that they do a breast exam, self breast exam every month?
You know what? It just depends on the patient. If you're average risk, the guidelines from the American College of Obstetrics and Gynecology, and I think like the American Cancer Association, they've changed the guidelines for just average risk women. They don't think it really improves the detection or survival rate, especially, I guess, probably in an area where there is awareness and people are getting mammograms. I guess if you're in an area where the awareness of what you're looking for in the breast isn't out there, or if there aren't like available mammogram screening, self breast exams would be recommended. But I tell my patients just be mindful, know what's normal for you. So if there's something that's abnormal, come in and see me.
Okay.
So I think that's kind of the main issue with that. I think they were having like more false negatives than or false positives. I guess people thought they had, people, if you're poking around at that breast, you're going to feel a lump, something
Right. Yeah.
lumpy. Like I said, if it's not something that that is like a cancerous lesion, but just something that like makes you anxious or worried, you could come in and if you tell me that you feel something, I'm going to check it typically just to get a baseline of what's going on in there, decrease your anxiety and things like that. But on my watch, I want to make sure everybody is comfortable with their care.
Yeah, advocating for yourself is so important in anything, especially
Yeah,
medical.
sure.
Um, so
Yeah.
so go
Exactly.
back to BRCA. What if it is positive? What does that mean? I mean, to a normal person out there that has nothing, no medical knowledge or anything, what does that mean?
So if you come into the office and I'm doing an exam on you and I'm getting some family history and you tell me something like, yeah, my mom had breast cancer under age 50, my grandma had it younger. I'm like, well, when we hear about younger women getting breast cancer, we think of breast cancer as and this is changing, with our life and the world and the more pollutants there are out there. But breast cancer was typically like an older person's cancer because, as you get older, your cells are not cleaning up the abnormal cells as well. So it would trigger me to think like, why are these young people, why is your young mother at age 40 getting breast cancer? Is there something genetic? Was it, and it could have been more environmental, it could have been sporadic, it could have been lifestyle, but we always rule out, is it something in her genes that her genes are not helping keeping her healthy? And that's where, I'll ask, like, has your mom had genetic testing? And, the patient will be like, either, yes, she did, and she was negative, then the patient doesn't have to worry, or no, she didn't, she's passed away since. So I'll recommend the patient go get genetic testing. She'll talk to a genetic counselor. The genetic counselor will get all the family history on her and do a blood test called the Myriad My Risk, called My Risk screening. And I think it tests for over 48 different mutations. They're not all breast, there's some ovarian, there's some colon in there. I think melanoma, um, kidney, maybe. I can't think of everything that's in there, but if the test would come back BRCA1 or BRCA2 positive, it does increase the risk of that patient getting breast cancer by like 50 to 70, 50 to 80% in a lifetime. I did
Wow.
recently have a patient that is BRCA1 and she never had any problems and she just got diagnosed with like I think like just the in situ or like the stage 0 breast cancer at age 70. She's lived with BRCA1 for 70 years and never had any problems till now. But it does, it puts you at a higher risk. So we do offer extensive screenings for those patients. Those patients I would recommend to do a monthly self breast exam, call with any changes. We'll do your mammogram screening yearly and offer supplemental screening where we're screening you every 6 months instead of every 12, or you come in at 6 months and we do a breast MRI to make sure that the mammogram didn't miss anything. Mammogram is very important. A lot of patients want to just do MRI or just do a breast ultrasound because they've gotten called back before and they think the MRI and the breast ultrasound are more specific. They are more specific, but there is some specificity in the mammogram with detecting like small uh, precancerous calcification is in the breast. And that's where we want to start with checking that first. And then we can go on to like an ultrasound or breast MRI to see if like the mammogram is missing something like in the dense tissue that we're not seeing, like more like a lump or something like that.
Okay. So did you want to
Okay.
give any kind of wisdom, advice, something that you feel is so important that every woman needs to know?
I mean, I think the one of the most important things from my perspective, talking about just women's health, breast cancers, like I said, start with that foundation of health, healthy eating as well as you can. Obviously, enjoy life, eat, have your cake and eat it too, type of thing. But healthy eating, exercise, try to stop smoking. If you're smoking, try to wean off that. It's important. Try to cut back on any alcohol use that you're doing. Because that's a huge risk factor. Try to maintain a healthy weight as much as you can with your exercise. Start with that foundation, and then to build on that, try to get in for annual, women's health exams, whether it be with your provider at a clinic or if there is a health department you can get into. And then definitely be aware of what is normal for you, for your breast. I think those are kind of the three big things, take home messages to know. And then the last one of knowing your breast, if something seems different or is off for you, to notify your healthcare provider.
So
Yeah.
I want to thank you for being here. This information is so
Yeah.
important. Um,
Yeah.
and if you are in the Springfield, Illinois area and you need a health provider, Robin's at Springfield
Yeah.
Clinic. And like she said,
Yeah.
you can go to Memorial Medical Center and they have Mondays that have free mammograms, but you have to call to get
Uh-huh.
that scheduled. And there is also, if you do not have insurance, and you need women's health,
So,
you could go through the Illinois Department of Public Aid to get that
mhm.
Illinois breast and cervical, or Illinois, what's the stand for anymore? Illinois breast and
Breast and cervical cancer program.
yeah, and that they will
Yeah.
pay for the mammograms, the pap smears, the
Mhm.
birth control, that they pay for like anything that's women's health. So that
Yeah.
is very important to take care of because there are a lot of people out
Yeah.
there that don't get it because they don't have the money or the insurance to get it. Yeah.
Yeah.
All right.
It was so
Well,
fun. You're doing
yes.
good things, Gina.
Thank you, Robin.
Keep on.
I
Yeah.
am. Bring awareness to everything.
That's right. You're a good mentor, a good sounding board, um, a good advocate.
Yeah.
So
Try.
women
I
are
try.
lucky to have you inside.
Thank you.
So
Thank you. Thank you. All right.
yeah.
Well, thank you. And I'll be talking to you
Yeah.
about menopause.
Yes. Okay. On to
All
the
right.
next women's health issue.
Yep.